Spick, Beaner. Go back where you came from. Lazy, angry. We think she's a gang leader. Well, you're not college material, so you shouldn't really bother in looking at or applying to colleges. These were all words and phrases I heard while trying to make sense of my life as a Latina in a predominantly white high school. The worst was being told I wasn't college material from none other than my high school counselor, who I thought would help me get back on my feet. Little did I know that these experiences would set the foundation for understanding my own mental health and creating the blueprint for my passion and life's work. But before I explain to you a little more about the importance of Latino youth receiving quality behavioral care, a little more about my story and where this passion grew from. I was born and raised in Washington, D.C., to a Salvadorian father and Guatemalan mother. My parents' reason for immigrating to the United States was none other than the civil war that was occurring in Central America during the late 70s and early 80s. My parents feared for their life, and so did many others. Walking past decapitated bodies, murder victims, rapes, and other crimes were an everyday norm. As a result, my parents lived in fear until they escaped to the US. And when my sister and I came along, we were raised in fear. Then my life changed completely at the age of 6 years old. I was sexually abused by a non-family member. And in all honesty, this is where a lot of my anger stemmed from. So why is this important for you all to know? Well, it's what fueled my desire to become a licensed clinical social worker. It's what fired up my passion to work with what was later coined as the Jackie Specials by my previous agency. Or, in other words, extremely difficult inner city youth of color, or angry kiddos. In other words, if they didn't have a rap sheet full of felonies, misdemeanors, had never assaulted police officers, were known as drug dealers, fighters, or hustlers, I didn't want to work with them. And my boss knew better than to stick a youth in my office who was angry at her parents for not getting her a Mercedes for her 16th birthday. Why is listening and working with Jackie Specials so important to our future and our growth as a nation? Well, let's take a bigger look at this picture. These youths are trying to tell us their story through their anger. It's their language. And as a society, we're not listening. No kid wakes up in the morning saying, how can I be a pain in the ass today? Maybe some do, but pretty sure the majority don't. The way I was labeled, these same Latino youth get labeled the minute they throw a chair, curse at a teacher, light their first doobie. Labels such as ODD, CD, addict, fiend, criminal, future murderer, gangbanger are thrown around, but no one stops to ask, what's really going on behind that anger? We make assumptions about them, their home lives, their families, and then I even stop to ask myself, I wonder how my life would have been different if one of those adults who was so quick to make assumptions would have stopped to ask, why is she so angry? But then a lot of the times we also forget, or we may not be aware of, that Latino youth are more likely than their peers to suffer from depression, post-traumatic stress disorder, generalized anxiety disorder, and substance use disorders. They're more likely to be misdiagnosed, more likely to experience suicidality, more likely to seek treatment when symptoms are at their worst or irreversible, and more likely to drop out of treatment and feel no connection because there aren't enough clinicians that look like me. So why are these numbers for Latino youth so high? Well, let's take a look at another picture. Latino youth experience many unique circumstances, such as less educational opportunities, discrimination, cultural differences between their environment and their family, as well as a higher likelihood of poverty. In regards to post-traumatic stress disorder, approximately 72% of kiddos, Latino kiddos, experience or are exposed to trauma. What research has also shown is that Latino culture influences a major role in how abuse and or exposure to the trauma are dealt with and whether or not it contributes to increased levels of anguish. These same experiences contribute to both internalizing and externalizing problems that include increased negative behaviors, decreased school performance, and other mental health issues. These results would indicate then that the lack of knowledge in regards to mental health might possibly exacerbate symptomology as well as decrease the likelihood that treatment will be sought, much less completed. And despite anxiety being one of the most identified mental health issues amongst Latino youth, minimal research has been completed on anxiety isolated from other diagnoses. There needs to be more efforts to understand how these Latino youth are impacted by anxiety. Substance use disorders. There are higher levels of alcohol and drug use amongst Latino youth in comparison to their African American and Caucasian peers. And they're also, unfortunately, less likely to receive treatment. It seems that across the literature, despite these numbers continuously increasing, effective interventions aimed at prevention or symptom management have yet to meet the cultural expectations in treating substance use amongst Latino youth. And in spite of alcohol being the mostly used substance amongst Latino youth, research is starting to show that a new contender is in town. This research has shown that increased drug use has been more so related to marijuana, and despite this decreasing the use of other drugs, researchers believe that marijuana use by Latino youth could lead to dependence and problematic behaviors in the future. Something to also consider in regards to substance use is machismo. I'm pretty sure you guys have heard of this terminology, and it's well known in the Hispanic culture. Machismo plays a role in that youth are more willing to take risks compared to their peers because they don't want to lose face. They don't want to seem like less of a man. So they're going to go with the peer pressure, and they're going to try to show them who's boss. Not to mention, typically in Latino households, male teens are given more freedom and questioned less as their rite of passage to being a man. This freedom is what allows these additional opportunities to engage in risk-taking and unsupervised behaviors. And there's a lot of other issues to consider. For example, language barriers. Besides machismo, there's also marianismo. Family not being made aware of what mental health is and how to support it. And acculturation. The family pain or adjustment, believe it or not, also becomes the youth's pain, even if the youth was born here. These youth who are either born in the U.S. or are brought to the U.S. from their home countries face difficulties that none of their non-Hispanic white peers face. A youth might be in a household where Spanish is the primary language spoken and cultural practices from their home country are followed, yet once enrolled in school, they are challenged to take on another role as students adapting and conforming to American culture. So how does this impact our Latino youth? Well, they're more likely to drop out and not pursue higher education. They're due to live a life of economic hardship and have even more difficulty in acculturating to American culture. Now, what does this have to do with everyone else? Think about it. This makes it more possible for bigger reliance on already strained systems and institutions. It makes these adults dependent on systems because they were never taught the way, much less supported. So how do we start working with these Latino youth and their families? Sometimes it can be as simple as listening or rapping. They are the experts. I once had a client who did all his trauma work and his basically challenging every negative thing he's ever experienced in his life through poetry and making his own rap songs. That kid is due to graduate this year from high school. It's important to look at other models that include family components and psychoeducation. This is what helps strengthen the use of drug resistant skills and advancing anti-substance use attitudes. Acknowledging their pain, not what they should or shouldn't be working towards as a minority. Pain is pain, and it's real and it's theirs. And it's our job to help them recognize this. Increasing the knowledge of Latino culture, networks, and professionals. Share how you relate to them. Only if true, of course. Don't make anything up. And they can see you as a person and trust you. And nonetheless, support, support, support. So, the end of one chapter and the start of another. So how did someone like me who experienced most of what I've talked to you about today leave all of this behind? Well, not only did I have the support of my parents, but also the support from a school social worker and teachers at my alternative school where I completed the rest of my junior and senior year, who believed in me and saw my potential. They saw through my pain. They showed me that I was more than what I showed them at school. Along with my parents, they instilled in me the importance of fighting back with education and knowledge. Not to mention my testaruda ways, which means stubborn in Spanish. So I say to you, every child deserves a right to thrive. Latino youth deserve quality mental health and substance use care. It should not be a luxury and only available if you have the correct skin color. It is a human's right to be valued, supported, and loved. How will you make a difference in the life of a youth of color? This brown girl dared to believe and was able to achieve and leave that life behind. I want other brown kids to do the same, and I hope you are willing to make this an ultimate truth. Thank you.